Hello doctors, I am Dr. Vijita. Today I am going to talk about the differences between government and private DNB institutes. First things first, there is no difference between the fees in government or private DNB institutes. It is same all over India. In each year you pay 1,25,000 rupees both in government and private DNB institutes. Now the difference of stipend. In any DNB institute, generally the stipend is same of the stipend of MD and MS of that state. But in private hospital, they give the stipend as TDS, that is tax deducted salary. And in some cases, the corporate hospitals also offer extra RMO duty. For that, they pay you extra. But in private medical colleges, there will be no extra duty and they will give you the same stipend as the state. In the government institutes also, stipend may be slightly higher in ESI hospitals or railway hospitals. Kindly check on the individual stipend structure. Now the dreaded part, the duty hours. As first year residents, duties are gonna be hectic. There is no other way. Now the difference between duty hours of government and private hospitals. In most government medical colleges and government district or subdivisional hospitals, you have to do one on-call or two on-call duties with your guide, co-guide, and rest of the days you go for round and do one or two OPDs. But from second year onwards, your duties are less hectic. Your consultants will give you chance to study more and to be less involved in ward activities like doing procedures or going through every patient. You can focus on your academic cases and study more. And in corporate hospitals, the duty will be same throughout your course. You may have to go there every day and stay there from 9 to 5. They may give you some on-call duties also. In all corporate hospitals, you may not get OPD exposure, but I cannot make a generalized statement. Please inquire about individual institutes. In most corporate hospitals, you may not get ample hands-on at the first, but with time, when you build trust with your consultant, with your patient, you will get scope to do the procedures also and to actively participate in the ward rounds also. After surviving 2.5 years in DNB, I know another thing is very important, which may not be thinking at this moment right now, which is thesis. You may not always get help with your thesis in your institute, but you will find other ways. I will make another video on how to do your thesis easily. Another very important point is study leave. NB says there is no provision of study leave, but unofficially we get study leave as third year PGTs. We sit in our home for last 1 to 2 months and study for exam. But in corporate hospital, you may not get the chance. In corporate hospital, you may have to attend your duties till the last day. In the end, I will emphasize on one point. Please inquire about the individual institute and take your decision wisely.